This is our scholarly notebook project by Reagan Robertson, L.E. Quintanilla, Carly Nichols, and myself, Priscilla Rodriguez. So our research question. We are really wanting to look at what are the outcomes of applied behavioral analysis therapy on the emotional well-being, social communication, and volitional occupational participation, such as play and leisure in children ages 3 through 10 diagnosed with autism spectrum disorder.
Our goal to financially implement our research involves collaboration with the American Occupational Therapy Foundation through grant funding. So, we are seeking $50,000 over a 1 year period to facilitate our research on the outcomes of applied behavioral analysis on social emotional well being in children ages 3 to 10 diagnosed with autism spectrum disorder. We selected the implementation research grant and submitted a letter of intent to the AOTF. This specific grant is the best fit for our research as it is awarded to researchers who are seeking to advance the science of occupational therapy to support people's full participation in meaningful life activities. A diagnosis of autism impacts all aspects of an individual's daily occupations. ABA therapy encourages positive behaviors and discourages negative behaviors to improve a variety of life skills. While we are aware that ABA is traditionally supported as an evidence based practice, the long term social emotional effects impacting one's mental health have yet to be explored with sufficient literature. Our mission aims to identify the long term effects of ABA therapy on emotional functioning and volitional occupational participation in children with autism, as well as mitigate any negative repercussions associated with this intervention. Our long term goal and our plan moving forward with this research is focused on helping occupational therapists implement evidence based research into evidence based practice to provide the highest quality of care to individuals with ASD across all settings and populations. So, this next slide displays the IR research grant that we were able to apply for. And we selected grant option number 2. And this was the best fit for us as our research aims to implement a pilot study over the course of over the next year.
The specific aims of this pilot interview study would be to determine the extent of existing knowledge on ABA therapy among OT practitioners. And this would be in preparation for a larger survey in which we would survey a large sample of OT practitioners in a variety of settings to determine common knowledge regarding ABA and ABA outcomes. And then this would all be leading up to a larger mixed method study where we would compare outcomes of ABA therapy on children with autism to the outcomes of traditional OT interventions in regards to occupational functioning. And then more specifically, we would be focusing on emotional well being and social participation. And then so, for the background, applied behavioral analysis therapy is based on the behavioral psychology model. And then these principles were introduced by John Watson and B.F. Skinner in the 1960s. And the idea is that it uses rewards and punishments in order to change behavior and then produce a desired outcome. So, if you're familiar with the rat boxes, Skinner conducted research in which the rats were only fed if they pressed a lever in their cage, and then they were rewarded with a food pellet. So, this inspired the rats to continue to press the lever. And then on the other side of this, Skinner found that if a rat was administered a shock through an ankle monitor, that they would not press the lever. The amount of times they would press the lever would dramatically decrease no matter how hungry they were. And so these ideas in relation to ABA therapy with autistic children were introduced in 1987 using the antecedent behavior consequence model. And so using this model, the child is prompted to engage in a behavior either by the environment, the context, or the caregiver, and then that would be considered the antecedent, whatever causes the behavior. And then if the child engages in a desirable behavior, they would receive a positive consequence, such as reinforcement like praise or a sticker. Um, a token, things like that. And then if the child responded to the antecedent with a non-desirable behavior and undesirable behavior, they would either be encouraged to participate in the preferred behavior through hand over hand, or their undesirable behavior would be ignored. So these approaches to undesirable behavior reduce bodily autonomy, which results in a wide range of harmful outcomes to a group of children that are already very prone to abuse. Um, and then they also do not allow the child to express why they are not engaging in the desired behavior. So this could be sensory deregulation or an inability to communicate their internal well-being.
So this next slide displays the IR research grant that we were able to apply for. And we selected grant option number 2. And this was the best fit for us as our research aims to implement a pilot study over the course of over the next year. I'm going to discuss the significance behind our research question. As many of you know, applied behavioral analysis is one of the most empirically studied and validated approaches to treating children with ASD. However, there's little evidence on the long-term psychological impacts of ABA therapy amongst all individuals with ASD, especially those individuals considered lower functioning, non-English speaking, and nonverbal. A recent study examined the prevalence of post-traumatic stress symptoms in individuals who had undergone ABA therapy as children. The results were significant, with over half of participants meeting the diagnostic criteria for PTSD. So, what does all of this mean to our research? So, our research will compare outcomes of ABA therapy versus traditional OT interventions, and we will be looking through a lens of emotional well-being and social participation. Next, for those of you guys who are more visual, here is a graph just showing some of the statistics on adults with ASD that have reported PTSD related symptoms following ABA. So at the top, we have the 47% reporting severe symptoms following ABA therapy. And at the bottom, we have 86%. And that's the chance that ABA therapy will increase that individual's likelihood of developing PTSD symptoms. And if you look just right there in the middle, you can see that it's almost half of people will have some symptoms of PTSD following ABA. So all of these numbers are quite significant and contribute to our reason behind our research question.
So in terms of our design, we want to conduct an exploratory sequential mixed method, which will begin qualitatively with a semi-structured interview being given via Zoom with a pediatric occupational therapy practitioner to discuss their past or current experiences with applied behavioral analysis therapy when it's applied into practice with these children with autism spectrum disorder. And then from there, really further discuss their existing knowledge on ABA and if it has any potential relationship with post-traumatic stress disorder among these children following ABA therapy. So our pediatric occupational therapist practitioner will be selected via different Facebook groups, Instagram pages, or professional relationships. And then when we were formulating our list for these Facebook groups and Instagram pages, we really wanted to make sure that they were OT based or OT focused. After the interview is conducted, from there, we'll each individually code it and find common themes, and we'll discuss that further later in our data analysis. But then based on what we gather, we want to formulate a survey that is going to help us further gain the understanding of the outcomes that applied behavioral analysis therapy has on these children with autism spectrum disorder, specifically looking at their emotional well-being and social participation. The survey will be developed via a survey generator like SurveyMonkey and then be shared for data collection via the internet. The survey will also be cross-sectional, so we won't be collecting the data over time. Some inclusion-exclusion criteria would be that OT practitioners to have had experience working with children and adults with autism spectrum disorder, and OT practitioners with past or current experience working in applied behavioral analysis or having applied the principles of applied behavioral analysis into their sessions. And then also those practitioners with PTSD background or experience. It will be a convenient sampling. So a final survey will be sent out to different registered behavior technicians in ABA clinics and then different pediatric occupational therapists. And then, oh, sorry. And then in terms of just a look at some of the interview questions that we would ask, or some of the questions that would really guide us with our interview would be like, what is your definition of ABA? What is your knowledge of the evidence behind ABA therapy? What is your knowledge of the evidence supporting the occurrence of PTSD in children that have gone through ABA? What is your experience with the clinical application of the evidence? What are some benefits, pros, cons, outcomes, etc.? Pros and cons of ABA specifically, really wanting to get down to that. Effects on their ADLs, IDLs, effects on their social communication following ABA or with kids who've gone through ABA, effects on their volitional play, and effects on their emotional well-being, again, following ABA. So overall, with our pilot study interview, we really want to determine the extent of existing knowledge in ABA therapy in order to determine those common themes among those occupational therapy practitioners, and then survey the knowledge regarding ABA and ABA outcomes among several OT practitioners. And then lastly, with our mixed method, we really just want to compare the outcomes of ABA therapy and what that has on children with autism spectrum disorder to those outcomes of traditional occupational therapy interventions. And again, really specifically looking at their emotional well-being and their social participation.
So for the data analysis, we will complete the coding individually to find common themes. During the first cycle of coding, we will complete description coding. This summarizes the topics of the data into a word or short phrase. Preceding the first cycle of coding, we will come together and discuss the common themes that we each found. Once we have these common themes discussed, we will move on to the second cycle of coding using these common themes. The second cycle of coding will consist of pattern coding, and this will lay the groundwork for our quantitative study. After coding, we will develop a quantifiable survey. Analysis and structure of the survey will be determined after coding of the interviews is complete to ensure it is well aligned with the findings of our coding. Our goal for completing this study is to explore how occupational therapists view ABA therapy. By using an occupational therapist for the qualitative interview, we're able to decrease bias towards ABA therapy that might be present if we interviewed an ABA technician. This is because ABA technicians have a chance of being more biased towards ABA being positive as it is their profession. Occupational therapists are also able to provide a unique lens that dives deeper than standardized assessments, as they can assess components such as occupational well-being, occupational performance, and occupational participation. So after we complete the interview and coding cycles, we will generate a quantitative study survey based upon the themes that we discovered. The goal of this quantitative survey is to understand the lasting effects of ABA therapy on children who went through this program and are now adults. There is limited research on ABA therapy from a qualitative perspective. A majority of the research done is quantifiable. However, new research is beginning to surface that shows a link between ABA therapy and negative emotional well-being. Some common findings are PTSD and psychological dependence. Our study will provide an in-depth perspective of the general knowledge and perception that occupational therapists currently have regarding the use of ABA therapy on children who have autism spectrum disorder. We hope that by completing this study, we will have a better understanding if there are lasting negative effects linked to ABA therapy. If we find there is a connection, then we can support occupational therapy's advocacy of non-harmful interventions that are performed by occupational therapists.